Welcome to Neural Nexus Podcast, where we explore the hottest topics shaping the world. Let's dive in.
All right, so we all know alcohol isn't exactly like a health food, right?
Right.
But did you know it's linked to at least 7 different types of cancer?
It's true. Yeah, and it's, we're talking breast cancer in women, colorectal cancer, esophageal cancer.
Oh, wow.
Even cancer of the voice box, liver, mouth, and throat.
That's a lot. It's a pretty extensive list. And the reason we're doing this deep dive is because a U.S. government advisory came out on this very topic. So we're going to go through this advisory and really kind of unpack it all for you.
Yeah, it's not about being preachy or anything. It's just about giving you the information
Right.
so you can make, the best choices for yourself.
Exactly. So let's start with the why. Why does alcohol increase the risk of cancer?
Well, they break it down in this advisory into 4 main reasons.
Okay.
The first one is this substance called acetaldehyde.
Okay.
And basically, that's what your body turns alcohol into when it's trying to break it down.
Oh.
And acetaldehyde is not so friendly to the body. It can damage your DNA and then prevent your body from repairing that damage.
Oh, interesting.
And so damaged DNA is, one of the pathways to cancer.
So it's not necessarily like the alcohol itself. It's what our body does with it
Exactly.
that causes the problem.
Yep.
Okay, so what are some of the other ways that alcohol increases our risk?
Well, the second one is all about hormones. So even moderate drinking can actually increase estrogen levels.
Okay.
And we know that higher estrogen is linked to certain cancers, especially breast cancer in women.
So it's like this chain reaction. Alcohol, higher estrogen levels, potentially leading to higher risk of cancer.
That's right.
Okay, got it. What's number 3?
Number 3 is it kind of goes directly to the cancer cells.
Okay.
It fuels the growth of them.
Oh, wow.
So alcohol can actually kind of like fertilize the cancer cells and help them grow.
So not only is it potentially like damaging cells, creating this environment where cancer is more likely, it's actually helping the cancer cells to grow.
That's right.
Gosh, that's a little alarming. What about number 4? What's the 4th way?
This one is it can make it easier for your body to absorb other harmful substances,
Okay.
especially things you find in tobacco.
Oh, okay.
So if someone is, drinking and smoking, their risk factor goes up even more because the alcohol is helping their body absorb those cancer-causing agents.
So it's like an accelerant in a way. It's
Yeah.
all kind of starting to connect in ways I hadn't really thought of before. And here's something that I thought was really interesting from this advisory. Less than half of Americans even know about this link between alcohol and cancer.
Huh?
I mean, I knew alcohol wasn't healthy, but I didn't really think about this direct connection to cancer.
It's a knowledge gap for sure. It's one of the reasons we wanted to do this deep dive and, really make this information, accessible and, help people understand.
Right, because it's really important that we all have the information so we can make choices.
Right.
So let's talk a little bit about, some of the specifics here. What about the types of cancer? We listed them at the beginning, but is there like any more information about like why these particular cancers are linked?
Yeah. So let's start with breast cancer since they kind of really, highlight that connection. So some of the cells in the breast tissue are particularly sensitive to that acetaldehyde we talked about.
Uh-huh.
And remember, alcohol increases estrogen levels.
Right.
And high estrogen can also fuel the growth of certain types of breast cancer cells.
Okay.
So you kind of have these 2 mechanisms at play that kind of, make that a double whammy for breast cancer risk.
So for women especially, this connection is really important.
Absolutely. And it's not even just like if you drink, it's how much you drink.
Good.
So, the more you drink, the higher the risk. And if you look at the global impact, it's pretty significant. Actually, according to the infographic, alcohol consumption was responsible for over 741,000 cancer cases worldwide in 2020 alone.
741,000. Wow, that's a lot. It really makes you realize that this isn't just some small or isolated issue. This is a pretty big public health concern. I want to be clear, though. We're not trying to scare anyone with this information. We really are just trying to empower people
Yeah,
with knowledge
exactly.
to make their own choices about their own health.
And that's actually where the next part of our deep dive comes in.
Okay.
Because this advisory, they actually give you some resources and tools that you can use to, kind of assess your own situation and decide what's right for you.
Perfect.
So we'll share all those with you in just a bit.
And remember, everyone's risk is different.
Of course.
It depends on your genetics,
Right.
your lifestyle choices, your overall health. There are a lot of factors at play.
Yeah.
But having this knowledge is a really powerful first step.
It really is. It's taking control of your health journey.
Exactly.
Yeah.
So we've talked about the why behind the alcohol and cancer connection.
Yeah.
And it's honestly kind of a lot to take in. I'm really curious about those resources you mentioned.
Yeah.
What if someone's listening to this and they're like, okay, this is a lot. Where do I even begin?
Well, the advisory actually points to some really helpful resources.
Okay.
One of them is the Substance Abuse and Mental Health Services Administration, or SAMHSA,
Okay.
and they actually have a national helpline that you can call.
Oh, wow.
It's completely confidential.
Okay.
And it offers support and resources for anyone who's concerned about their alcohol use.
So you can actually like reach out to someone, talk to someone,
Exactly.
get some guidance.
Yep. And for those who like a more personalized approach,
Okay.
the CDC actually has this free online tool
Oh, cool.
where you can track your drinking, get feedback based on your own habits, and even set goals for yourself if you're thinking about cutting back.
So it takes all the guesswork out of it and gives you some concrete steps.
Exactly.
Okay, so we've got the helpline for more immediate support and this online tool for a more tailored approach.
Right. And I think it's worth mentioning that for some people, avoiding alcohol altogether is really the safest choice. Like
Yeah.
pregnant women,
Yeah.
people taking certain medications, anyone with certain health conditions.
Right, because everyone's situation is different.
Exactly.
And it's all about having the information so you can make those choices.
Absolutely. And while this advisory focuses specifically on cancer,
Right.
it's a good reminder that excessive drinking can have like a whole cascade of negative effects on your health.
Oh, yeah. Heart disease, liver problems, mental health issues.
Right. The list goes on.
It really does, yeah.
So it's a bigger conversation about public health
Uh-huh.
and how we address these kind of interconnected issues.
Right.
But for this deep dive, we're really focusing on the cancer link.
Right, and I think we've covered a lot of ground.
We have.
We looked at the why behind the alcohol-cancer connection, the specific cancers that are involved, the global impact. We even talked about some resources that people can turn to if they want to learn more or, make a change.
And remember, the point of this deep dive is not to instill fear or to tell anyone what to do.
Right.
It's about empowering you with knowledge
Yeah,
so you can make informed decisions about your own health.
exactly. Knowledge is power, right?
It is.
And, it's interesting. I've been thinking about this whole time. We know about this link between alcohol and cancer.
Yeah.
Why isn't there more awareness about it? Like, why don't we see more public health campaigns that are focused on this?
That's such an important question.
Yeah.
I think it kind of speaks to this larger challenge
Mm.
of how do we translate scientific evidence into information that really motivates people?
Right, like what kind of messaging would actually make a difference?
Exactly.
How do we reach people from all different backgrounds and walks of life?
Right. It's a big puzzle.
Yeah, it is.
And it's not just about messaging. It's also about who's delivering that message.
Okay,
Like healthcare providers, for instance, they play a really key role. Right.
in having those conversations.
So true. There's a lot to unpack there.
Yeah,
And for our listeners who are really interested in diving deeper, we'll make sure to include links to those resources that we talked about,
yeah.
like the SAMHSA helpline and that CDC interactive tool.
Those are a great place to start for anyone who wants to learn more or get some support.
So as we're kind of wrapping up here, I think the main takeaway for me is that even small changes can make a big difference.
I agree. Yeah.
It's not about going from 0 to 60.
Right.
It's about taking those steps in the right direction.
Every step towards a healthier lifestyle is a win, really.
Yes, so true. So true.
And it's never too late to start.
Now, I want to leave our listeners with kind of a final thought here.
Okay.
Knowing what we know now about this link between alcohol and cancer, what are some creative ways that we could raise awareness about this?
Yeah, it's a tough one.
But an important one.
For sure.
And I think, when it comes to our health, knowledge is power.
And the more we know, the better choices we can make,
Exactly.
for ourselves and our well-being.
Yeah,
This deep dive has definitely given me a lot to think about.
me too.
So to our listeners, we hope you found this deep dive insightful, maybe even a little inspiring.
Yeah,
Remember, you're not alone on this journey.
right.
There's support out there. And every step you take towards a healthier lifestyle is a victory worth celebrating.
Couldn't agree more.
So until next time, stay curious, stay informed, and take good care of yourselves.